Welcome to another episode of Absolute Talks. I'm Conrad.
And I'm Jack. In today's episode, we're going to discuss the predictability in which modern-day clinicians can restore a hybrid when using a prototyping workflow.
Jack, talk to us about the importance of processing one of these hybrids in a full digital workflow and how this helps us to be more predictable with the clinical deliveries.
Okay, a digital workflow is absolutely key to predictability. When restoring a hybrid, it's crucial for a 21st century laboratory to have the ability to process these cases in a full digital workflow. We start all of our hybrid cases with a digital wax-up, having the ability to then superimpose the diagnostic wax-up into the patient's smile picks. It allows for a very effective communication tool between the lab and the clinician.
The question I get quite often is, how accurate is a jump between this digital data and bringing it into an analog world where the patient is?
Extremely accurate, because we now have the ability to model match the pre-op model, the patient smile picks, and our diagnostic wax-up. We can bring this digital wax-up into the analog world very efficiently. So the approved wax-up data is transferred to our milling or printing units, and we start the process of prototyping. Here at Absolute, we offer a long-term PMMA provisional or prototype fabricated from Harvest Dental's double cross-link PMMA. You know, this provisional prototype serves two purposes. First and foremost, it's the try-in. And secondly, after the case is complete and the hybrid, the final definitive prosthesis is delivered, then the patient gets that provisional back that they can keep with their records in case of emergency.
Awesome. So am I correct in saying this emergency hybrid is an exact copy of the final?
Most definitely so. As a matter of fact, this digital fabrication is so accurate that when we process a dual arch case, the final and emergency denture arches are interchangeable.
That's amazing. After patient approval of the prototype, how do you transfer this approved data to the final?
Okay, we could either transfer the approved data via digital scan or simply remove the approved hybrid and return it back to the laboratory for a copy mill.
What would you say is our biggest mission with the Absolute Art team?
Well, our goal at Absolute, more specifically with the Advanced Restorative team, has always been to be a support structure to our clinicians. I strongly believe in things like, not grinding on post-sintered zirconia, and training with the team. Most importantly, I also believe it's essential for our customers to deliver a product that requires absolutely no or minimal adjustment in delivery. A delivery appointment is actually a delivery appointment, and we're there to help support you with these large and complex cases.
For more information on this, you can download your clinical protocol manual on how to restore one of these hybrids at absolutedentallab.com, or just contact us directly.
We're excited to process your next case with you.
Thank you for joining us for another Absolute Talks edition.
Stay safe
and stay healthy.